Hi, my name is Kyla Bennett, and the partner that I worked with for this presentation is Matt Jenkins. So today we wanted to discuss how occupational therapy can help with medication management and polypharmacy in the older adult population, and then how this can then affect and benefit third-party payers and regulatory bodies. So, as third-party payers and regulatory bodies, we know that you are in the healthcare field, but we wanted to give a brief overview of what occupational therapy is. Occupational therapy is a healthcare profession that enhances patient independence and the quality of their life through functional interventions. Occupational therapy focuses on promoting safety as patients regain their independence so that they can then function in their daily life activities. So the challenge with medication management and polypharmacy in older adults. A lot of older adults face multiple chronic conditions, which then lead to them taking multiple medications. As they're taking multiple medications, this then increases the risk of adverse drug interactions, medication errors, and medication non-adherence. This then impacts the quality of their life. Safety and effective medication management is important to maintaining health and independence, especially in older adults. So, to provide you with some statistics, about 40% of adults are taking at least 5 medications each week, and 20% are taking 10 or more medications weekly. And then, of these percentages, 50% are incorrectly using their medication. That is a high percentage of patients who are misusing their medication. And when they're misusing medication, there are so many effects that then come. So, some of these effects can include falls, which can also lead to fractures and broken bones, adverse drug reactions, hospitalization. The patient may experience confusion and depression, and death is also a part of misusing medication. So, how can occupational therapy help with medication management and polypharmacy? Occupational therapy can enhance medication safety and adherence. This can be done through assessments. So, occupational therapists can conduct comprehensive assessments that will be able to identify barriers to medication management. Some of these barriers can include memory complications, physical limitations, and difficulty following medication instructions. All of these barriers can then lead to the patient misusing their medication. Occupational therapy can also help to prevent medication errors through home modifications and the use of adaptive tools. Occupational therapists can recommend environmental adjustments that can reduce medication risks. A few examples include a labeling system and making sure that their medication is accessible and organized. And then the use of adaptive tools like pill organizers and medication reminders can be taught to the patient so that the patient is then able to manage their medication independently. So, cost effectiveness with medication management. Adverse drug events and hospitalizations cost a lot of money. As occupational therapists work with patients to reduce medication misuse, this then reduces these incidents of adverse drug effects and hospitalizations, which can then lead to cost savings for you, the third-party payers and regulatory bodies. And then, as occupational therapists work with patients, they can help enhance patient safety through functional interventions, which can then prevent falls and injuries, reducing the need for further healthcare expenses. And then, occupational therapists can go and provide home health care, which can provide cost-effective skilled interventions that improve the patient's functional ability and safety within their own home. So this is a study done on how medication management can help with cost effectiveness. So this study was done from the National Library of Medicine, and the population was an older adult Medicare population that were taking statin medications. So the results showed that adherent beneficiaries had fewer outpatient and inpatient visits, lower outpatient and inpatient costs, and lower total costs. A calculated savings of $157.32 per member per month. So these results provided new information by demonstrating that adherence is associated with lower healthcare costs in a short time frame. And the time frame for the study was about 1 year. But this study goes to show that when patients are able to maintain their medication correctly, that it lowers the other healthcare expenses and costs, which then helps insurance and third-party payers and regulatory bodies to be able to save money. So this also then leads us into the benefits for third-party payers and regulatory bodies. So the financial incentives that we just talked about, and then meeting regulatory standards and guidelines. Occupational therapists, they understand the rules and regulations for justification of services and billing, and occupational therapy services can aid in reducing medication errors, improving adherence, and enhancing functional independence, which all align with those quality standards. And then again, the financial incentives are helping patients to maintain medication management to reduce excessive healthcare expenses. So in conclusion, occupational therapists can bring value in improving medication management and patient safety while reducing polypharmacy risks and preventing medication errors. Occupational therapy services can provide cost effectiveness for third-party payers and regulatory bodies by improving the health and safety of older adult patients through medication management. And then these were our references for our studies and statistics. Thank you so much.